Everyone, today we'll be discussing multiple myeloma. This presentation provides an in-depth overview of multiple myeloma. It covers the disease's background, clinical features, treatment strategies, complications, as well as future directions to enhance understanding and management. In this video, we'll explore multiple myeloma, starting with its definition and epidemiology, followed by clinical presentation and diagnostic methods. Next, that will follow will be the treatment options that will be discussed along with complications and supportive care. Then thereafter, we'll end with discussing the prognosis and current ongoing research. So, understanding multiple myeloma, definition and epidemiology. Multiple myeloma is a malignant plasma cell disorder that is characterized by clonal proliferation in the bone marrow. It accounts for approximately 1% of all cancers and mainly affects older adults with incidence varying globally. Pathophysiology and disease mechanisms. This disease arises from abnormal plasma cells that produce monoclonal immunoglobulins that leads to bone destruction, immune dysfunction, and organ damage. Understanding this mechanism is critical for diagnosis and targeted therapy. Risk factors and genetic predispositions. So the risk factors include age, male gender, African ancestry, exposure to radiation, and family history. Genetic abnormalities such as translocations and deletions in plasma cells influence prognosis as well as therapeutic responses. Clinical presentation and diagnosis. Common signs and symptoms. So patients will often present with bone pain, anemia, fatigue, recurrent infections, hypercalcemia, and renal impairment. Recognizing these symptoms early facilitates prompt diagnosis and management. So what we need to know is that bone pain is a frequent symptom, okay? So when somebody comes with bone pain, multiple myeloma is something that should be explored, especially in the absence of trauma or other factors that may have led to the bone pain. Lab tests and diagnostic criteria. Diagnosis relies on serum and urine protein electrophoresis, immunofixation, free light chain assay, bone marrow biopsy, and criteria suggest the presence of more than 10% of clonal plasma cells or the CRAB features. So when we talk about the CRAB features, what are we referring to? So we need to look at the clinical features, and that's where the CRAB comes in. So C stands for calcium elevation, which is hypercalcemia. R stands for renal insufficiency, which is as a result of renal damage. Anemia, which is low red blood cell count, and bone lesions, which is destructive bone changes that can be seen in an X-ray or CT scan. Imaging and staging systems. Imaging techniques include skeletal surveys, MRI, PET, CT, and CT scans to assess bone lesions. Staging systems like the International Staging System ISS use beta-2 microglobulin and albumin levels to stratify the risk. Treatment approaches. Common induction therapies include a combination of proteasome inhibitors, immunomodulatory drugs, and corticosteroids aimed at reducing disease activity prior to transplantation or maintenance therapy. So to look at the proteasome inhibitors role, so they help with protein degradation, okay? So that leads to a reduction in the disease activity before transplantation or further therapy. Then the immunomodulatory drugs, they focus on modulating the immune system. And steroids usually work in reducing inflammation and suppression of the immune system. So this is usually used in case we're preparing patients for transplant or maintenance treatment. Role of stem cell transplantation. Autologous stem cell transplantation remains a standard treatment for eligible patients, offering prolonged remission and survival benefits when combined with effective induction regimens. The novel agents and emerging therapies. Advancements include monoclonal antibodies, CAR-T cell therapy, and new proteasome inhibitors that offer promising results, especially in relapsed or refractory multiple myeloma. Complications and supportive care. Managing bone disease and hypercalcemia, bisphosphonates and denosumab help reduce skeletal-related events. Hypercalcemia requires prompt hydration, bisphosphonate therapy, and monitoring to prevent severe complications. Infection risk and prophylaxis. Patients are immunocompromised and prone to infections. Prophylactic antibiotics, vaccination, and vigilant monitoring are key strategies to minimize infection related morbidity. Renal impairment and supportive management. So, what we need to know is that renal dysfunction is quite common due to light chain deposition and hypercalcemia. Early detection, hydration, dose adjustment of nephrotoxic drugs, and dialysis, when indicated, are vital for care. Prognosis and future directions. Prognostic factors and survival rates. Prognosis depends on disease stage, cytogenetic abnormalities, response to treatment, and patient health. Survival rates, however, have improved significantly with modern therapies, but they vary greatly among individuals. Patient monitoring and long-term follow-up. Regular assessment using lab markers, imaging, and clinical evaluation are essential to detect relapse early and manage long-term treatment side effects effectively. Ongoing research and future therapies. Research focuses on novel immunotherapies, precision medicine approaches, and combination treatments to improve efficacy, reduce toxicity, and ultimately achieve cure. Conclusion. Multiple myeloma is a complex hematologic malignancy with evolving diagnosis and treatment paradigms. Ongoing advances continue to improve patient outcomes, underscoring the importance of comprehensive management and research. That's all about multiple myeloma. If you like the video, please like, subscribe, and comment. Thank you.